Good day. From the Johannesburg hub of the NIHR Global Surgery Unit based in South Africa, I am Deirdre Kruger, Associate Professor in the Wit School of Clinical Medicine at the University of the Witwatersrand. And this presentation has specifically been recorded for the Global Surgery Unit's training platform. And the presentation is entitled Research in Clinical Medicine, Why Do Research? And How to Develop Good Research Questions. Briefly, an overview of what I will be covering in this presentation. Why do research? You, the researcher, you as the supervisor of other researchers and or postgraduate students. How to develop good research questions to ultimately ensure a good outcome while at the same time maintaining research integrity. And finally, why publish your research? So I have cited many references in compiling this presentation, but in particular, this textbook on the right, A Practical Guide to Biomedical Research for the Aspiring Scientist by Professor Michael Hassenkamp, who is not only an honorary member of the Faculty of Health Sciences at the University of the Witwatersrand, but also a professor of cardiovascular surgery at Aarhus University in Denmark. So why do research? Throughout the history of mankind, curiosity and an open mind have been the driving force behind discovery. What is over that hill? What is across that body of water? What can be found in the dark depths of space? Essentially, research is about pursuing curiosity, leaving no stone unturned in an eternal search for new discoveries that will improve the understanding of ourselves and the world around us. In the 50s, we saw Crick and Watson puzzling out the 3D structure of DNA. In the 60s, deciphering the genetic code saw Crick and Sidney Brenner conclude that each amino acid coding element consists of 3 nucleotides. In the 70s, DNA sequencing and the expression of proteins in plasmids. In the 80s, PCR and the development of the first recombinant vaccine for hepatitis B. More recently, in 2019, saw major advances in immunotherapy in the treatment of cancer. And of course, the robot surgeon, reducing room for error in operations. People have different reasons for pursuing research. You may want to attain an academic degree or qualification. You may want to just boost your CV. You may want to succeed in academic surgery in this current era. Or you may just want to check what all the fuss is about. Nevertheless, research is about pursuing your curiosity and fueling your passion. Because a genuine interest is arguably the most important driver for sustained engagement in research. You need to fuel your passion because your project would take you from extreme happiness to deep frustration and everywhere in between. An existing interest in your research field is not a prerequisite for success, but in times of trouble, your passion for the subject is sometimes the only thing what gets you out of bed in the morning. An example of someone with a genuine interest and pursuing their curiosity is Edward Jenner, our English country doctor working in an agricultural community. He was very familiar with the country folklore that milkmaids never caught smallpox. They had flawless complexions, unmarked by smallpox scarring. Inevitably, they caught cowpox through their close work with cows. Edward Jenner speculated that a bout of cowpox produced immunity against smallpox. In May 1796, he inserted pus taken from Sarah Nelms, a milkmaid with cowpox, into a cut made in the arm of a local boy, James Phipps, the 8-year-old son of his gardener. Reportedly, he felt cold and loss of appetite at day 9. In July of the same year, Jenner deliberately exposed the boy to smallpox. He was found to be immune. Now, this raises all sorts of ethical issues nowadays. And in this quote from Carol Levine in 1988, ethics in research was born in scandal and reared in protectionism. And we've come a long way since this Edward Jenner example. The Nuremberg Code from 1947, which was expanded as the Declaration of Helsinki in 1964. And of course, we've had various revisions of this. Nevertheless, research is a central and indispensable component of improving health. Particularly in developing countries, the need for research related to the burden of diseases and the improvement of healthcare is urgent. You as a surgeon or clinician embarking on research will have a dual role going forward, and it's important to note the following. The clinician's role in the clinician-patient relationship is different from the researcher's role in the research subject relationship, even if the clinician and the researcher are the same person. The clinician's primary responsibility is the health and well-being of the patient, whereas the researcher's primary responsibility is the generation of knowledge, which may or may not contribute to the research subject's health and well-being. Therefore, there is a potential for conflict between these two roles, and when this occurs, the clinician role must take precedence over that of the researcher. You, the researcher. How can a busy practicing surgeon successfully develop and maintain a research program? So the most successful clinical researchers or surgeon scientists develop a research program that very closely mirrors their clinical practice. Your main reason for establishing a research program should focus on advancing scientific knowledge of a disease of interest to you, again, pursuing your curiosity. Maintaining a successful practice and being successful and productive in research is very difficult. And if your passion is for anything other than helping others by advancing science, it will be very hard to maintain your energy and your focus. A successful research program requires planning and preparation before starting your first project. Once started, achieving your research goals requires dedication, efficiency, as well as institutional support. You may embark on independent and collaborative research, and both are encouraged. Importantly, you need to have a good balance between your clinical and academic commitments, because the rewards of being both a scientist and a surgeon far outweigh the stresses of this dual life. You, the supervisor. So the successful academic surgeon has spent several years doing some form of research during their training. And it is the mentorship that comes along with an experience like this that is most vital to an individual's development as a researcher. Research is not a technical skill. It's rather a way of thinking. Your general approach should be to solve problems. And research is a systematic approach to improve understanding and enhance the current body of knowledge. Importantly, you need to spend a significant amount of time reading the literature broadly to be updated about new research trends and their applications in your field of interest. You need to encourage creativity as a supervisor with trying new avenues of research, and you remain the principal investigator. Importantly, you need to develop your research program that very closely mirrors your clinical practice. For example, if you are an HPV surgeon with a keen interest in pancreatic diseases, in particularly pancreatic cancer, you will develop your research program to investigate, first and foremost, the demographic and clinical characteristics of your pancreatic cancer population. You may want to look at the routine circulating blood markers already measured and how they are associated to the demographics and clinical characteristics of your population. Then you may want to expand your research program by also looking at other pancreatic diseases and perhaps even comparing them to that of pancreatic cancer. Following this, you can further expand your research program by looking at drug discovery studies or any of the omics for pancreatic diseases. You may collaborate, for example, with a diabetic clinic to see whether new onset adult diabetes is indicative of pancreatic cancer, or rather vice versa. Expanding further beyond this, you may collaborate with your colleagues and look at the same type of markers, omics, and drug discovery studies in other HPV diseases, further expanding your knowledge of your local population and again contributing to the existing body of knowledge. Finally, you can embark on other cancers and again do comparative studies or at least collaborate and share your expertise with your colleagues from the same department. So how do you define a new postgraduate project in your research program? So this question is very applicable in an academic setting where most of our consultant surgeons are also supervising postgraduate degrees. Particularly in South Africa, our training surgeons have to all complete a Master of Medicine research component as part of their surgical training. So this is where you as a supervisor need to know how would you define a new project within your research program. So really, you as the supervisor should not or do not have to. As I mentioned before, you should encourage creativity with trying new avenues of research. So rather collaborate with your student to define the project, and you will act as the moderator to ensure that this project still falls within the scope of your research program. The student will obviously do the work in drafting the research proposal and convince the student to adopt the project as their own. You need to guide your student, though, to make closed questions with clear hypotheses and clear answers, regardless of the outcome. So how do we develop good research questions? Because a good research question is essential to guide your project, and it needs to pinpoint exactly what you want to find out, and it should give your work a clear focus and purpose. So there are some boxes that a good research question needs to tick. Good research questions are focused on a single problem or topic and researchable using primary and or secondary sources. Your good research question will avoid subjective words, such as good, bad, better, or worse, as these do not give clear criteria for researching the question. If your question is evaluating something, use terms with more measurable definitions. For example, rather than saying, is treatment A better than treatment B, and better not being a measurable definition, state how effective is treatment A compared to treatment B at reducing rates of Z. Also, why questions are usually too open to serve as good research questions. There are often too many possible causes that a research project cannot give a thorough answer to a why question. For example, why does X occur? That's very broad. Try asking what or how questions instead. For example, what are the main factors contributing to X? Or how is X influenced by Y? Okay, so apart from being focused and researchable, good research questions also need to be feasible and specific. Feasible to answer within the time frame and practical constraints, and this is of particular importance when there is a time-limited postgraduate degree qualification on the line or even a grant funding deadline. And then, of course, your research question needs to be specific enough to answer thoroughly. So, to be feasible and specific, your question needs to be answerable within practical constraints. Again, enough time and resources should be available to answer your question. If not, you need to narrow or broaden your question. Feasible and specific research questions use well-defined concepts. Terms in the research question should have clear meanings. Avoid vague language and broad statements. Be clear about what, who, where, and when your question addresses. For example, what effect does insulin have on the absence of two key signaling components? Rather ask a more specific question. What effect does insulin have on liver metabolism in vivo in the absence of clearly defined two signaling components. Also, a good research question does not ask for a conclusive solution, a policy, or a course of action. Research should inform. You should inform, not instruct. It should aim to improve the understanding, the policy, or the management, and suggest possibilities rather than demand a ready-made solution. Bad example. What should departmental or hospital management do about low registrar turnout at ward rounds? This is not a very specific question. Rather ask, what are the most effective communication strategies for increasing registrar turnout at surgical ward rounds? Again, this better helps you to define your project because it's more specific and well defined. So apart from being focused, researchable, feasible, and specific, our good research question should be complex enough and arguable so that you can develop your answer over the space of a manuscript or paper. It should obviously also be relevant and original to your field of interest or to your society more broadly. Let's talk about being complex enough and arguable. So you cannot just answer your research question by a plain yes or no, because what are you going to put in the rest of your manuscript? Closed yes or no questions are too simple and do not provide enough scope for investigation and discussion. For example, has there been an increase in laparoscopic appendectomies over the past 10 years? Yes, there has. Or no, there hasn't. Rather ask, how have training and technological advancements affected the use of laparoscopy over the past 10 years? Okay, complex enough and arguable questions cannot be answered with easily found facts or figures. It requires original data, interpretation, and arguments to provide an answer. Complex and arguable questions provide scope for debate and deliberation. This is essentially important in an essay or research paper, where the answer to your question often takes the form of an argumentative thesis statement. Okay, so the answer should not just be a simple statement of fact. There needs to be room for discussion and interpretation of your findings. What about having relevant and original research questions? So these address a relevant question, a problem, or a gap in the existing knowledge in your discipline or field. This makes it relevant and this makes it original. It contributes to an existing academic debate that's current in your field or in your society at large. It should produce knowledge that future research can build on. It's certainly something that has not been answered before if it's original, and therefore it has this aspect of originality. For example, by focusing on a specific location or taking a new angle on a long-running debate, you will have a relevant and original research question. So again, ensure that your good research questions are focused, researchable, feasible, specific, complex enough, and relevant to your field of interest. And therefore, your good research question can generate a realistic hypothesis, which can be extrapolated into a clear aim and result in a clear conclusion, i.e., answer. Good research question is publishable, and the outcome leads to follow-up studies. So ensuring a good research outcome really encompasses a lot of what we've already said. You need to have a good student-supervisor relationship with good communication. Again, your research needs to be driven by genuine interest and fueled by passion, pursuing your curiosity. A research project which answers a good question will ensure a good outcome. And be sure to research something that others can benefit from, not just yourself. A good study design, which is well thought through and ethically sound, will also ensure a good outcome. And how do you achieve this? Well, this is based on a good literature review, a good study size, which is based on statistical power calculations, Funding ensured upfront, not afterwards. We've seen so many research projects fall flat because funding was not secured upfront. And a lot of data does not translate into a good research question, and that's a good point to remember. So these factors contribute to good study design. And particularly with regards to statistical power, if your study is underpowered, then you really cannot rely on your, so to speak, significant p-value. So be sure to do a power calculation up front to know how many study subjects do you require to actually have a sound answer to your hypothesis. Again, to ensure a good outcome would be to have results which can be published, regardless of whether it's negative or positive findings. Project outcome leads to future research projects or follow-up studies. This makes for a great outcome. And also, if you can produce a paper which is frequently cited by others, this is certainly a good outcome. This will not only enhance your H index, but it can also make you famous. So for those of you who don't know, an H index is an author level metric that measures both the productivity and citation impact of the publications of a specific scientist or scholar. And therefore, the more papers you write and the more that they are cited, the higher your H index. For example, if you have 3 papers that have all been cited at least 3 times by other authors, then you have an H index of 3. So apart from being curious, pursuing your passion, and developing a good research question, you really should ensure that your research program runs with research integrity. Academic integrity is a commitment made up of core values of fairness, honesty, trust, respect, and responsibility. The aim of science is to uncover the real workings of the natural world, and that requires honesty. You can't get to the truth by exaggerating your results, fudging your numbers, selectively reporting data, or interpreting evidence in a biased way. Please ensure academic integrity, and please make sure that this diffuses into your subordinates, or your students under your supervision. When no one is watching, it is the character of the investigator that determines the moral quality of the research. If research integrity is problematic, we must start and end with the investigator. So finally, why publish your research? Publications play a key role in the research life cycle. Your publication is one brick in the wall of scientific advance. Publishing your research is your gateway to the scientific community and has a lasting effect on your career. No scientific paper is an endpoint itself. It's always part of a larger process. And again, your engagement in the scientific community will build your reputation, and people will await your presentation at the next conference. Science exists and progresses by one set of work being built upon someone else's. If you don't communicate your research findings, it might not as well have happened. And this is very important. I often have students with negative data asking me, but am I still going to pass my degree? Like, my findings show nothing. I'm not going to get this published. Yes, you will. Like, this is as important. You need to communicate your research findings regardless of whether it's the outcome or the association that you were hoping to find. Also, publication is very important for your career, for promotion, for future funding opportunities. Certainly, scientists are judged by the papers they produce, and again, the more your papers are published and cited, the higher your H index. And then collaborators. So you need collaborators. And again, once you've built a reputation, you will easily find collaborators and also funding. So you need these collaborators. They will help you make an even better paper the next time. You will become part of their research as well. And all of this goes towards building your reputation in this field of interest. So finally, in conclusion, this is what we spoke about. Why should you embark on research and take on this dual role of clinician and researcher? Then we discussed you as a researcher, and then also you as a supervisor of other researchers or postgraduate students. Given you some tick boxes on how to develop good research questions and ensuring a good research outcome. And please remember to always maintain research integrity. And then why it's important to publish your research. So obviously I cannot take any questions now, but I do want to refer you to my main sources in this presentation, as shown here. Also, a lot of the information is what I have gained in my 11 years working in the Wits School of Clinical Medicine in research and surgery. So thank you to all my references, and I wish you all well in your research endeavors. Thank you so much for your attention. Keep well.